Well, a warm welcome to this talk, Wednesday the 14th of July. Now, I'm just going to start off with something Dr. Tedros from the World Health Organization have said. Now, we've had our discussions around the World Health Organization, but I think this is fairly unambiguous. Direct quote, Delta variant is ripping around the world at a scorching pace. This is the case. It is ripping around the world at a scorching pace, unfortunately. Otherwise, this pandemic would have been pretty well over by now, at least in Western countries. Now, a few orientation slides first of all. I'm going to start off with English-speaking countries first of all. So here we have the situation. So we're going to get a special report from Australia later. New Zealand, low, of course. Australia, worrying cases now in Sydney area, in New South Wales, and also in Victoria now. Canada still going down. United States, definitely an upward increase. Ireland, an upward increase, consistent with quite a few places in Europe, unfortunately. Now, South Africa cases were going up. And of course, if you've been watching the news, you'll realise there's been, well, anarchy really in parts of South Africa. So the data hasn't been collected for the last few days. So unfortunately, I don't think this is a genuine dropping off or levelling off here. It's due to the situation in South Africa. If anything, the current riots and looting and lawlessness in South Africa will make this worse. South Africa going into winter, of course, and United Kingdom, well, dear me, speaks for itself really, doesn't it? Cases are still escalating dramatically quickly in the UK. Moving on to Europe. So we still see that the UK is worse than most places in Europe. So I've left the United States on for reference. Belgium, Denmark, Greece, Portugal, Spain, Netherlands, UK. But I think you'll agree that all of these, Germany's not so bad actually, Norway, Finland, Sweden not so bad. But I think you'll agree that all of these countries, well, Netherlands, dear me, Spain, showing a dramatic increase, Delta variant driven. We've been anticipating this for some time. And the worst country I've kept till last, Cyprus. So that's like double the cases of the UK. I mean, astronomical, exponential increase. I mean, if you look at this, the increase in the UK, then the steepness of the Cyprus line, that shows you what the Delta variant can do without the right inhibiting measures in place. So no question here there's going to be some difficult times ahead in Europe. Now I just want to go on to the UK now. I want to show you this from the UK. So here we have some UK figures. Now we see the vaccination programme is going still quite well. But let's look at the new, let's look at the summary here first of all. So 27% of increase in positive tests in the week, 42% of deaths within 28 days, and 53% increase in admissions. Now, fortunately, the deaths and admissions are still relatively low. But if we look at cases here, we do see the increase is starting to look quite dramatic, and it's becoming a well-formed third wave. So that was the Alpha variant wave, Kent variant. This is the Delta variant wave. Variant first identified in India. Going on to healthcare, we do see increases. So increase in case people admitted to hospital. So for example, it's up to latest daily total there, patients admitted 538. Patients in hospital, 3,615. So that's the patients in hospital. Nothing like where we were, but it is starting to put some pressure on health services in some areas. Deaths, well, again, we're starting to see a slight increase as we have predicted for some time in the UK. So dramatic increase in cases in the UK continues. This is going to continue for several weeks yet. With the easing of restrictions on the 19th, we've got to really carry on almost as normal as we are now. even though it's not going to be a legal requirement. Otherwise, hospitalisations will start to go up quite dramatically. And we already have such a backlog of people waiting for care. This really is resulting in a lot of suffering and some deaths, unfortunately, because of the backlog of ordinary care that we simply haven't got round to. So, ripping around the world at a scorching pace, Myanmar, the country that used to be called Burma, at least 5,000 cases in the last 24 hours, up dramatically. Now, testing in Burma is very poor, and of course we know that they've recently been taken over by the military. Civilian leaders are imprisoned. Many protests, riots on the street, terrible situation. So this is the absolute minimum number of cases. They're the ones diagnosed. But what's more concerning to me than this number of cases is the positivity rate, 25%. And actually in a city that used to be called Rangoon, now called Yangon, I think, it's nearer a 33% positivity rate, indicating massive rapid community transmission in Myanmar. Very low vaccination rate, very limited access to healthcare. News is difficult to get, so I went to Radio Free Asia. Now, this is normally pretty good. There's the link there. Click on it. The website is usually pretty accurate, actually, Radio Free Asia. So I've used that one. They're saying coronavirus treatment facilities at capacity already. Hospital beds and oxygen at short supply already. Rationing of healthcare. Patients deemed either too sick to be saved or not sick enough are turned away. Of course, this means a lot of people are at home without oxygen. Therefore, lines of people looking for oxygen in Yangon and Mandalay, the city that was Rangoon. Because people being turned away, they can't get into hospital, so the relatives are desperately foraging around for oxygen to try and find it, which they're not finding. And there are many reports in that Radio Free Asia report of people dying from oxygen shortages in Myanmar, and that's only going to get worse over the next weeks as well. So another example of just a sad situation. Without the military unrest there, the situation could have been so much less damaging to so many people. Now, Taiwan. Taiwan, interesting. Here's the graph. They did so well for such a long time, then all of a sudden a lot of cases. But look at this. Even though it's largely Delta variant, they've got this under control in Taiwan. Now, this is truly impressive. And this is despite limited vaccinations. Political difficulties, of course, getting vaccines from China. Japan has so the United States have sent some vaccines. Japan to supports Taiwan more and more now. AstraZeneca, they're sending a total of 3.3 million shots, or they've sent that so far, and they are sending more. So this is largely with non-pharmaceutical old-fashioned interventions. Pretty impressive performance there from Taiwan. China, relatively low numbers of cases in China. Vaccination program going very well. 1.39 billion doses of vaccine given out so far. So that is going well. And the Chinese, I believe, are looking into getting some messenger RNA vaccines as well for a potential booster dose. So that was interesting. Now, vaccine mandates. Dear me. I mean, I was asked this question on Deutsche Welle in the interview on the German TV yesterday. And, they said, what about the ethics of mandatory vaccination? And I gave the arguments for it and the arguments against it. And dear me, the response from people, the emails full of vitriol. How dare you support mandatory vaccinations? And I was doing no such thing. I was just giving the cases for and against this